Child psychology. Child psychology is an important branch of psychology that focuses on the mental, emotional, social, and behavioral development of children from birth to adolescence. Childhood is a crucial period because experiences during this stage strongly influence personality, behavior, learning ability, and mental health in later life. Nurses play a key role in understanding child psychology to provide holistic and child-centered care. Definition: Child psychology is defined as the scientific study of growth and development of a child's behavior, emotions, thinking, personality, and social relationships from infancy through adolescence. Role of nurse in meeting the psychological needs of children. Children have special psychological needs such as love, security, acceptance, understanding, and emotional support. Nurses play a multidimensional role in fulfilling these needs at different levels of care.
1.
Nurse as a primary care provider. Definition: As a primary care provider, the nurse delivers first-level, continuous, and comprehensive care to promote physical, emotional, and psychological well-being of children. Role in meeting psychological needs. Establishes a trusting and therapeutic relationship with the child. Provides a sense of security and safety during illness and hospitalization. Assesses emotional status, behavior, and developmental level. Reduces fear and anxiety by explaining procedures in simple, age-appropriate language. Encourages parental presence to promote emotional comfort.
2.
Nurse as a coordinator and collaborator. Definition: As a coordinator and collaborator, the nurse works with healthcare professionals, family members, and community services to provide holistic child care. Role in meeting psychological needs. Coordinates care with pediatricians, psychologists, social workers, and teachers. Ensures continuity of psychological care during hospital stay and after discharge. Collaborates with parents to understand child's emotional needs. Helps in planning individualized care according to child's developmental stage. Facilitates referral for specialized psychological support when required.
3.
Nurse as an advocate. Definition: As an advocate, the nurse protects the rights, dignity, and emotional well-being of the child. Role in meeting psychological needs. Acts as a voice for children who cannot express their feelings. Protects the child from neglect, abuse, or emotional trauma. Ensures child-friendly care and pain-free procedures whenever possible. Promotes child's right to parental presence and emotional comfort. Supports ethical and compassionate care practices.
4.
Nurse as a health educator. Definition: As a health educator, the nurse provides knowledge and guidance to children and their families to promote psychological health. Role in meeting psychological needs. Educates parents about normal emotional and behavioral development. Teaches positive parenting techniques and discipline methods. Guides families on managing stress, fear, and anxiety in children. Promotes healthy coping skills and emotional expression. Encourages a supportive and nurturing home environment.
5.
Nurse as a consultant. Definition: As a consultant, the nurse provides expert advice and guidance to families and healthcare team members regarding child psychological care. Role in meeting psychological needs. Advises parents on handling behavioral problems and emotional issues. Guides healthcare staff on child-centered communication. Assists in developing psychological care plans for children. Helps in identifying early signs of emotional and behavioral disorders. Supports decision-making related to child mental health care.
6.
Nurse as a counselor. Definition. As a counselor, the nurse helps children and families understand, cope, and adapt to emotional stress and life situations. Role in meeting psychological needs. Encourages children to express fears, worries, and emotions. Provides emotional support during illness, hospitalization, or trauma. Uses therapeutic communication and play therapy. Helps parents cope with stress related to child illness. Promotes positive coping strategies and emotional resilience.
7.
Nurse as a case manager. Definition. As a case manager, the nurse plans, organizes, and evaluates comprehensive care services for children with psychological needs. Role in meeting psychological needs. Assesses individual psychological needs of the child. Develops and implements a comprehensive care plan. Monitors progress and evaluates psychological outcomes. Ensures access to required mental health services. Coordinates follow-up care and community support.